Welcome to Discovering Health, presented by Covenant Health Plainview. Your host for the show is Chris Moore, alongside various medical staff and health-related professionals. For the next 30 minutes, Chris submits the questions to the professionals that you have emailed in and discuss the topics that you want to know about. Now it's time for Discovering Health, presented by Covenant Health Plainview and Chris Moore.
Good evening. You're tuned in to 103.9 FM, The Pulse. It's 5 o'clock and it's time for Discovering Health, brought to you in part through the courtesy of Covenant Health Plainview. My name's Chris Moore, and joining me for today's program is Dr. Paresh K. Rajajoshiwala. Nailed it, man, on the first try. Rajajoshiwala, general surgeon and bariatric surgeon with Covenant Hospital Plainview. Dr. Raja, thank you so much for joining us this evening.
Thank you for having me here.
Yes, sir. Hey, first off, before we get into the questions, we've got emailed questions to us coming in and that kind of thing. Before we get in there, tell us a little bit about yourself. How did you end up in the panhandle of Texas?
Sure. Well, I was raised in Southern California. I'd practiced in Bay Area for about 4 or 5 years, and then about 15 years ago, moved out to San Antonio to practice general and bariatric surgery. I've been in San Antonio for the past decade and a half. My kids are all grown up. My son's moving on to Galveston for medical school. My daughter's moving to Lubbock to go to tech. Mm-hmm. So I thought it was a good time and good opportunity to look around for new opportunities, and Plainview seemed like a perfect community that fit the bill.
Great.
And here I am.
Man, right on. So is there like job descriptions and you're online just looking, or did you contact them, or how did all that come about?
Like a lot of other things, I got one of those emails where it said, hey, we're looking for an opening. We have an opening. We're looking for a general surgeon who may have other interest. And I applied, and this was the first place I looked, and it fit like a glove, and here I am. Great.
Well, exciting to have you here, and glad you're here. I always wondered how doctors, were able to find, different jobs, because you don't see it on Craigslist. You don't see, the openings in the want ads, or anything in the newspapers.
Absolutely. So there are specialty firms that only work with recruiting doctors for hospitals, and that's one of those recruiters contacted me, and I make the long story short, here I am.
Sure. Well, great. Well, thank you again for coming in today, and I'll tell you what, let's get right to the questions.
Sure.
Dear doctor, I'm a 55-year-old male who is about 30 pounds overweight. Now, when I started that, I'm guessing he's probably 45 pounds overweight. He's probably less than to 30.
Sure.
But anyhow, about 30 pounds overweight. Lately, I've been experiencing frequent heartburn and have an acid taste in the back of my throat. Now my doctor is telling me I have a hiatal hernia. Is this a serious problem, and is it something that might require surgery?
So, first of all, having acid reflux and having hiatal hernia are two different things. Not everybody that has hiatal hernia has heartburn, and not everybody that has heartburn but has hiatal hernia. The most important part here is that if you're experiencing frequent heartburn, then it should be addressed. Across the country, about 4 out of 10 people will experience heartburn once a month, about 2 out of 10 will experience it once a week, and 1 out of 10 will experience heartburn once a day. Now, having heartburn is inconvenient. It's painful, but it's also medically dangerous. So people who suffer chronic heartburn actually cause burns to their esophagus or the food tube as fluids in our stomach, which are typically acidic, reflux back into the esophagus. Mm-hmm. Like with most things, we want to treat them first by most conservative matter. So first of all, people can manage their diet. We know typically that if you're eating fatty, greasy, oily, spicy food, the heartburn is much more common.
The good stuff.
Yeah, absolutely. Like anything else in life.
Right.
We're also talking about a few other things. Alcohol, mint, chocolate, caffeine. Mm-hmm. These are also more stimulant that produce heartburn more frequently. Mm-hmm. So if you're experiencing heartburn, simplest thing to do is avoid some of those foods, so that will minimize the heartburn. We can also in this gentleman's scenario, is a little bit overweight. Overweight is one of the risk factors for having heartburn. So if you lose some weight, it will make the heartburn a little bit less common and better. And the next step would be to take medication. So nowadays, what used to be prescription medication, you can also get them over the counter. Zantac, Pepcid, Prilosec, Acifex, Nexium, all those medications can help minimize heartburn and ease the symptoms. So that would be the next step. If person who is doing all of that and is still having frequent heartburn, then it's a time to assess whether something more can be done, and typically that involves having an operation. In that scenario, we would fix the hiatal hernia. So to kind of step back a little bit, hiatus is an opening in our diaphragm that allows the food tube and other organs to communicate from the neck onto the stomach. So some people can have hiatus that's a little bit bigger, and that allows the stomach to herniate up into the chest. So in that scenario, we would repair the hiatal hernia, so-called make the opening smaller. In somebody who is experiencing frequent heartburn, we would also make a one-way valve at the top of the stomach so the acid doesn't reflux back up into the chest. This is very, very important because frequent heartburn can cause damage to esophagus. In long term, people can have strictures, erosions, ulcers of esophagus, but more importantly, long-term heartburn can also lead to precancerous stages of esophagus and ultimately can lead to cancer. So we want to minimize heartburn, and we want to make sure that people's quality of life is better, where every time you see a cheeseburger or a pizza, you automatically get a stomach ache because you know what's coming next if you eat that food.
Sure.
So all those things are important.
Okay. All right, good. So what you're telling me then is that, if you've got heartburn, try the Tums, graduate up to the Prilosec or
Sure.
one of those others. If we've still got problems, man, we need to give you a call.
Absolutely.
And let's get in there and check this thing out, see what the problem is.
In some circumstances, also people say that, well, if I take my Nexium, I'm okay. And that may be great, but if you have to take Nexium for the rest of your life, that's something to contemplate because people don't like taking medicines every single day. So some people say, well, can I just get rid of my medication? And sometimes a heartburn surgery would be a good option for them. Studies also show, because now these medications have been in the market for 20 to 30 years, that chronic use of anti-ulcer medication leads to osteoporosis as we take them for very long periods of time, and it can also lead to more bone fractures as we get older. And this is an important part. So sometimes if somebody is truly dependent upon those medications to maintain their quality of life, maybe they ought to give surgery a second thought.
Okay. All right. Very good. Very good. Okay, next question. Dear doctor, what are you looking for in a colonoscopy?
So first of all, let's kind of, for the lay people, what is a colonoscopy? And colonoscopy is basically looking inside your colon, which is our lower third or half of the intestine. That's where we make informed stool. First of all, this is very important because when we talk about cancers as we get older, in women we think about breast cancer, colon cancer. In men we think about prostate cancer and colon cancer. So all population, men and women, once they turn 50, the general recommendations are that they should have what's called a screening colonoscopy, just to take a look inside the colon and make sure we're not having any diseases which may impact us as we get older. Colonoscopy is basically putting a flexible camera inside our colon from the bottom and taking a look at inside of the colon. So things we're looking for when we do colonoscopy. First, we're looking at diseases that may affect the anus and the rectum. So we're looking for skin tags, hemorrhoids, any ulcers in the rectum, whatnot. But most importantly, we're looking for polyps which can eventually progress into precancerous and ultimately cancerous lesions. So those are the things we're looking for when we talk about colonoscopy. So for the audience out there, if you've turned 50 and you've never had a colonoscopy, it's a time to bring it up to your primary care doctor and say, hey, should I be getting one? That's important. Even if you don't have any symptoms, you're 50. Just like women get mammogram, men should be getting a colonoscopy. And generally, after the age of 50, if the colonoscopy is normal, it does not need to be repeated for about 10 more years, and then at that interval. Somebody who is not 50, if they have specific complaints, if they have a bloody bowel movement, if they have recurrent pain in the abdomen, which can be to something like diverticulosis or diverticulitis, all these things are examined and diagnosed by doing colonoscopy. So if you're having change in your bowel habits, if your doctor tells you and you're anemic, if you notice blood in your stool, then even people younger than age 50 are a candidate to have colonoscopy to help them diagnose what's ailing them and help make a treatment plan.
So what if, let's say, for instance, just for the lay people out there, okay, I'm thinking about diverticulitis because that runs in my family.
Okay.
All right, I'm 42 years old. If it's a history there, is that something you need to look at earlier or until you have a problem, or once you hit 50, then visit with your doctor?
If you have family history of diverticulosis or diverticulitis, based on that alone, you don't need a colonoscopy at age younger than 50. If you have a family history of multiple polyps or family history that's very strongly correlated for early age colon cancer, then people could make a case for having a colonoscopy at age younger than 50. But if you simply have a history of diverticulosis in your family, you don't need a colonoscopy unless we're seeing a recurrent problem at age earlier than age 50.
Sure. Okay. Now, again, for the lay people, and this is just me,
Sure.
I've never seen a colonoscopy happen. I've never had one myself.
Sure.
Doctor, how big is this lens? How about what do we? I mean, are we talking about a water bottle? Are we talking about a pencil? I mean, what are we?
We're talking about size, just maybe like a highlighter. How about that typical highlighter? So that's a diameter, something of that sort.
All right. Okay.
Right. It's flexible.
And I'm holding one now, looking at it.
Absolutely.
Yeah.
So there are controls on it, which allows the lens to move in all 360-degree location, because our colon does take a turn inside the abdomen. So it's for the newer generation, the millennials.
Sure. Yes.
It's a very easy test because we're looking at a TV monitor. First of all, the patient is sedated, so they're not feeling anything.
Okay,
They're
I like
completely
that.
asleep, even though you're breathing for yourself. It's what we call monitored anesthesia care.
Okay.
Anesthesia personnel is in charge of taking care of you, making sure you're comfortable. They're monitoring your vital signs. And we're inserting this camera while we're looking at the TV monitor. And ultimately, we want to be in the middle of the lumen as we advance. So a surgeon, in this case myself, would be advancing the scope, and I have an assistant who would simply advance the scope as we're looking forward. And then we would simply look at all the sidewalls, lumen of the colon, and make sure there's nothing unusual there that would require some treatment or documentation.
Okay. Well, that makes me feel a little better.
Right.
So and that's why we do this, man. So
No, I absolutely. The important thing to do, remember that if we're going to do colonoscopy, what most people, if they've had a colonoscopy, will remember, they've got to do the bowel prep the night before.
Drinking that drink, yes.
Absolutely. The dreaded drinking part where the day before you get to drink a large volume, typically up to a gallon, and then make bathroom your best friend. So make sure that you're completely clean so somebody could actually see all of it without having stool blocking your way and be able to help you make a good decision.
Right. And this may be something good, too, for teenage boys, to where we can see if their head's up there as well, right?
Do we even need a camera for that?
That's right. All right. Thank you, Doctor. Hey, folks, you've been listening to Discovering Health here on 103.9 FM, The Pulse, brought to you by Covenant Health Plainview and South Plains College. We're going to take a few minutes to hear from our sponsors and come right back to have Dr. Raj answer more questions sent in by you, our listening audience. Hey, folks, if you got a question you'd like answered, email your question to askforyourhealth@gmail.com.
Becoming a healthcare provider takes a special person. If you've ever dreamed of a career where you can make someone smile, keep someone comfortable, or soothe someone's fears, the Health Occupational Division at South Plains College can help open the doors to your future. With a stellar reputation for producing highly sought-after medical professionals, South Plains College is fulfilling the needs of tomorrow through its graduates today. And we provide our students with a quality education at an affordable price. Are you ready to make your dream a reality? Prepare yourself at South Plains College.
Surgical excellence is right here in Plainview. Dr. Yildiz and Dr. Raja with Covenant Health Plainview Surgical provides all aspects of general surgery to include abdominal surgery, surgical oncology, gallbladder surgery, appendectomy, critical care surgery, GI endoscopy, hernia surgery, and so much more. Professional and caring doctors right in your own backyard. That's Covenant Health Plainview Surgical. 806-296-7881.
We are back with Discovering Health, brought to you by Covenant Health Plainview and South Plains College, the radio program that answers the medical questions and concerns that you, the radio audience, have emailed in. In-house, we have Dr. Raja with Covenant Hospital Plainview. Dr. Raja, thanks again for being here, and let's go right back into our questions. Dear doctor, I heard you perform bariatric surgery. What are the most common weight loss surgeries available, and what do you have the capability to perform? Also, what are the benefits of this route of weight loss?
Well, lots of questions in that one lengthy question. So for those of you who may have already caught on, bariatric surgery is a fancy word for weight loss surgery. So before we even talk about the other details, first of all, weight loss surgery is typically for an individual who is at least 100 pounds or more overweight. So it's not for those few people we always run into, I've got 20 pounds extra or 30 pounds extra. So we're treating a significant amount of weight gain, 100 pounds or more, with surgical means. And that's what a bariatric surgery specialty entails. So let's get down to the questions then. What are the most common weight loss surgeries available today? So there are 3 to 4 different operations that have been around and have been accepted as a mainstream treatment of excess weight. So we're talking about The most common gold standard surgery in America is something that's called Roux-en-Y gastric bypass surgery, or what most people refer to as gastric bypass operation. Another much older operation that's still on the market, something called biliopancreatic division with a duodenal switch. We'll talk about that, but people just sometimes refer to that as a duodenal switch operation or DS operation. There's something called gastric sleeve operation, which is relatively newcomer on the market. By that I mean as a standalone operation, it's been around for about 15 to 20 years. One of the other operations which was quite popular about 10 years ago, which are kind of fading away, is something called gastric banding surgery, where people used to put a band around upper part of the stomach. The band was typically adjustable by inflating or deflating it and help people lose weight. So these are the common operations being performed across the country and essentially across the world to help individuals lose weight. Most common of these operations that people see across the country is gastric bypass surgery, which has been around for about 50 years, and gastric sleeve operation, which has been around for now roughly 20 years. I perform all of these operations. So we are in the midst of starting out a bariatric surgery program at Covenant Hospital in Plainview. And over the next month to 2 months, you'll be seeing a lot more marketing and a lot more rollout of this service line. But we will be able to perform a full spectrum of weight loss surgery catered and tailored to person in terms of what their needs are, what their overall medical history are, and what would be most beneficial for them. Going along with the question, what are the benefits of this route of weight loss? So for the past 50 to 70 years, we know people who are very heavy, what's medically called morbidly obese, we know that simply medical means of managing weight is not successful for long term. We've all met people who said, Doc, I was on diet 3 years ago and I lost 80 pounds. But most often when I look at them, they're typically heaviest they've ever been. Meaning people will say, it's easy for me to lose weight, but it's hard to keep it off.
It's kind of a yo-yo.
Absolutely.
Kind of up and down.
Because what happens, individuals make effort, they change their diet drastically, and then lose a lot of weight. But it's very, very hard to keep that momentum going, keep those good habits going, and keep that exercise regimen going. So frequently after the weight loss, they'll relax and they'll gain that weight back. What a weight loss surgery offers is a reliable way for very heavy individuals. Sometimes, my heaviest patient was 750-pound gentleman. So for these people who need to lose 100 pounds, 200 pounds, 300 pounds, the surgical operations provide reliable way to help them lose that weight and to keep it off. So the earlier study shows that when we talk about surgical means, such as gastric bypass surgery, when we look at a decade to 2 decades out, 90 to 95% of these people will have lost weight and will have kept off significant amount of their weight, which is the biggest difference between medical and surgical treatment of being severely heavy. Going along with the same route, what are the benefits? Obviously, the first benefit is that you've lost substantial amount of weight. Why is that important? A lot of people tell me, Doc, I'm heavy, but I can run up 4 flights of stairs. I don't have any health problems. Nothing hurts on me. Why do I need to have weight loss surgery? Why would I consider or cater to what the other people are telling me that I'm heavy? So studies show when individuals are heavy, when we talk about morbid obesity, they're more prone to diabetes, more prone to high blood pressure, more prone to high cholesterol. They're more likely to have sleep apnea. That's when we wear that little Luke Skywalker mask to breathe at night because we stop breathing without the help of that. So all those things are far more common. For women, irregular menstrual cycle, painful menstrual cycle, difficulty getting pregnant or conceiving, all these things are far more common. We also know when you're heavy, obviously all your joints are stressed more. So ankle pain, knee pain, hip pain, back pain, all these things are far more common. Along with that, oftentimes these people feel and are, as we know, frequently discriminated against in terms of employment, in society, in community. So they're also much more prone to have psychological issues because they feel like they're ostracized because of their size and weight. So when we talk about weight loss surgery, helping these individuals reduce their weight, we're going to reverse all those health problems which are directly related to their weight. So by simply fixing their weight, we're going to fix big issues: heart disease, by means of addressing diabetes, high blood pressure, high cholesterol. We're going to address their joint and bones problems by reducing that weight. For women, we're going to reduce all the issues that go along with frequent women issues. So many problems are reversed by addressing the central problem, which is excess weight. And that is the true benefit of weight loss surgery. Studies show that individuals who is morbidly obese, ultimately, because of all the other health problems they're facing because of their extra weight, their life expectancy is shortened by about 15 years. So in essence, by helping them manage their weight by weight loss surgery, we're offering and promising for them to regain about 15 years to the life expectancy.
Wow.
That is truly a very, very impressive statistic.
Sure, and who doesn't want to live another 15 years?
Absolutely.
I mean,
yeah.
That's great. That's great. Hey, folks, you're tuning into Discovering Health, presented by Covenant Health Plainview and South Plains College. We need to take a few moments and hear from the fine sponsors bringing you this evening's program, right here on 103.9 FM, The Pulse.
The Technical Education Division of South Plains College can help you get into a career in as little as 1 to 2 years. If you want to work in business administration, law enforcement, cosmetology, real estate, or the legal profession, a job can be yours in a short period of time. If your interest is in software development or network technology, that dream can become reality. South Plains College provides our students with a quality education at an affordable price. Explore these career opportunities and many more today. Prepare yourself at South Plains College.
We are taking questions with Dr. Raja, general surgeon and bariatric surgeon with Covenant Hospital Plainview. The program is called Discovering Health. The mission is to answer questions that have been submitted by you, the listener. Now let's get back to the questions. All right, Dr. Raja, I had an ultrasound scan of the abdomen for another medical problem. It showed several big stones in my gallbladder. Should I have my gallbladder removed?
This is a very, very important question. The reason for that is nowadays imaging studies are very, very common. Anybody who walks into emergency department or has a minor complaint or sometimes major complaint to their primary care doctor, they're likely to get some kind of imaging study, whether it's a sonogram or CAT scan or MRI. So we do see quite a few people who will show something incidentally, meaning they weren't looking for gallstones, but they happened to find gallstones. Lots of large studies show that people who have incidentally known gallstones, they don't need to have anything done to them. Studies show that if you have gallstones and then you have symptoms related to gallstone or gallbladder disease, then we should talk about how to treat them. So having said that, simply having gallstones in your gallbladder is not a reason to consider an operation or treatment of gallbladder disease. But if you know you have gallbladder full of gallstones and you have symptoms that I'm going to describe in the next few sentences, then you should see your doctor, or at least bring it up to him or her. So typical gallbladder and gallstone related symptoms are pain in the upper abdomen, more so on the right side. Frequently, patients will tell me that the pain radiates to their back. This pain usually is related to having eaten half hour to an hour before. Like most things in life, greasy, fatty, spicy, oily food tend to bring on gallbladder attack more so than healthy diet. Frequently, the attack or the pain is also associated with having severe nausea, vomiting. People break out in cold sweats. Sometimes they feel like their heart is racing. So all those things are typical descriptions of a gallbladder attack. So if you have history of or know that you have gallstones and you have those attacks, you should bring that up to your doctor. If you don't know you have gallstones, but you have symptoms like what I described, it's an important time to bring it up to your doctor that you've had these attacks, whether mild or severe, so your doctor can actually help you look for gallstones so something could be done about them.
And if you actually, how do you know you've got the stones without having the checkup, having the scope or whatever run?
Sure.
Do you even know? Can you feel them? Are they?
Absolutely not. Even for experienced providers, the gallbladder is fairly deep organ inside our abdomen. Usually liver has an overhang over the gallbladder itself, so it's difficult to reliably feel gallbladder and absolutely impossible to feel the gallstones. So an imaging study is required to know if you have gallstones or not. That's a very important part. But the symptoms I described are very, very crucial to help diagnose gallbladder disease, because those are gallbladder attack symptoms which are described in textbook. Now, not all the gallbladders read textbooks, so people can have different types of symptoms.
Right.
It is called the greatest masquerader of chest pain, kidney pain, just vague abdominal pain. Sometimes people just report the feeling that they feel bloated, they feel gassy, and the workup will lead to diagnosis of gallbladder disease. Gallbladder disease, meaning gallbladder with gallstones, can cause those symptoms. In some patients, even when they don't have gallstones, they can just have abnormal function of the gallbladder and cause almost exact symptoms. So all those things can be narrowed down by either doing an imaging study such as ultrasound or CAT scan. And if you're thinking about that there are no stones present, but their symptoms are so classical, then sometimes we may do actual functional study to see if the gallbladder is functioning, to help narrow down what may be the reason for those symptoms, and then make a treatment plan accordingly.
Okay. All right. Very good. All right, doctor, we're going to move downstairs a little further. Again,
Sure.
okay, where we were earlier. What are some of the symptoms of colon cancer?
Again, very, very important questions. I think we, at least in the beginning of the show, talked about what is a colonoscopy and why we would want to do them.
Yes.
And the part of the answer was that we do colonoscopies in individuals older than 50 as a screening test, meaning there are no symptoms at all. This is important because we want to find cancer if there is a concern when they're very, very small. If the colon cancer is very, very small, obviously there are almost no symptoms at all. Now, as the cancer grows, becomes larger, patients can lose small amount of blood in their stool. So that's why sometimes when you go to your doctor, he might ask you to smear a little bit of stool on that piece of paper and mail it in so they could see if there's a blood in your stool. So either notable or unnoticeable blood in stool is one of the signs that could worry us about having colon cancer.
Okay.
Of course, as a cancer grows bigger, sometimes people can feel unusual discomfort in their abdomen. They can feel their bowel habits are changed, sometimes difficulty passing bowel movements, because as the cancer grows bigger, it occupies larger and larger space within the tube of colon, which makes the stool. So then people might say it's harder to pass their stool when the cancer grows bigger. So those are important. As the cancer grows bigger, there's also a systemic effect of cancer. So people may say, I've lost my appetite, I don't feel well, I get night sweats. Sometimes they can say, I've lost weight without making an attempt to lose weight. So all these signs are worrisome for cancer in general, and sometimes they can be tied back to worrying about colon cancer. The bottom line is, small cancers, there are almost no symptoms, which is why we want to do a preemptive colonoscopy as individuals get older. And in rare instances, like we talked about earlier, if you see blood in your stool, you have a large bloody bowel movement, if you have bloody diarrhea, you feel very tired and your doctor checks your blood count and says you're anemic and we don't have a good reason for it, that's a reason to actually look to see if there is colon cancer or other diseases of the colon that can be causing those symptoms.
Also in the studio this evening, we've got Miss Sherry Wall, Mission Services at Covenant Health Plainview, to lead us in a short devotion.
Thank you. Jesus came here, walked the earth. He came to serve, not to be served. He showed us with grace how to be a great leader and a great servant. You all be blessed.
Well, it's about time to wrap things up. I'd like to thank Dr. Parish K. Raja Joshiwala, General Surgeon and Bariatric Surgeon with Covenant Health Plainview, for taking time to be here with us. If you'd like to schedule an appointment with Dr. Raja, give him a call at 806-296-7881 or stop by his office located at 2502 Xenia Street here in Plainview. I'd also like to thank each of you for tuning into this edition of Discovering Health, presented by Covenant Health Plainview and South Plains College. Have a medical question or concern that you would like to have answered? Drop us an email at askforyourhealth@gmail.com. For HPRN Radio, I'm Chris Moore. Stay healthy, my friends.
You have been listening to Discovering Health, presented by Covenant Health Plainview, with host Chris Moore, and exclusively on 103.9 FM, The Pulse. Do you have a specific problem or question that you want discussed? Email your question to askforyourhealth@gmail.com. And listen in every Wednesday at 5 p.m. for Discovering Health. presented by Covenant Health Plainview. The information discussed on the show are for informational purposes only. The purpose of the show is to promote understanding and knowledge of various health topics. It is not intended to be a substitute for diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment. Thank you for listening to Discovering Health on 103.9 FM, The Pulse.